welcome back to PA Chalk Up. I am your host, and today we have Obo. How we doing, Obo?
Hey man, how are you doing, Manny?
I'm
Thanks for
good.
getting me on the pod today. Really appreciate it, man.
Nah, it's all good. As we spoke off cam before, I just like having conversations with different people in different areas of this industry. So it's a pleasure to have you. And yeah, so if you just give us a little background on who you are, what you do, and how you got to where you are.
Yeah, man. So I'm currently a physical therapist. I went to school in Boston at the MGH Institute of Health Professions. I've been training for a year, and I work at two orthopedic spots. One being clinic, just standard outpatient in Boston, and then the other being a gym in just a surrounding city of Boston. And I just primarily work with orthopedic type cases at my full time job. It's more of a mix, some neuro, but mostly orthopedic. At the gym, it's just straight orthopedic type cases.
If you just give us a little background on exactly what you do with in terms of orthopedics and how that works with the gym and then your clinic.
Yeah, so in my clinic, it's just your classic pain. So like someone hurt themselves, comes in to see a physical therapist. A lot of it also as well is a lot of chronic pain. So what I mean by chronic, it's like people that have had pain for years and they decide to come into PT to get seen so they can like learn strategies to help with pain and kind of gain more independence and manage their pain. Just more independently. And then in my gym area, it's more of a lot more just younger clientele, a lot of people that are active, you know, doing a lot of just physically fit type of activities. And usually, uh, you can just edit this part out. You can, but I'm trying to make it.
No,
Sorry,
it's all good.
I'm sorry. Yeah, yeah. So it's just a lot more physically active people. So these are people that go to the gym every single day for the most part. Also, there's a lot of classes here, so like leg day classes, core classes. So usually on those days, I help out with the mobility portion of those classes. So it's usually split up into a mobility part, and then the trainers take over, and they're giving like the exercises and really working the people that come here. And as far as the people I work with here, a lot of it is just people that the trainers will refer over to me. So let's say so and so has a nagging hamstring injury or a shoulder problem going on, and they feel that it's something that they would benefit from seeing me. They'll ask that person if they want to come see me. They'll connect us, and I'll work with them for a couple sessions, a session or two, a couple sessions. Kind of depends what they want, what their needs are. The one thing I will say is that a lot of people that are at this gym are very independent, very much know how to work out, what to do. So a lot of times, it's not necessarily super extended times that I'm working with people. But I do have my clients too as well that, I'll be seeing them for a fair amount of sessions too as well. So just kind of depends. It's really a mix of different
Mix.
types of people. Yeah, for sure, man.
Yeah. Can we go back a little second? I've always wondered this, but
Yeah, for
I've
sure.
never had a solid explanation on what exactly it is. Can you explain what chronic pain is and how does it develop?
Yeah, so chronic pain. So this is something that so a pain that someone's just had for a long time. So this could be, you've been struggling. Let's say you've been struggling with low back pain, and this is something you've been dealing with for years. This is when that's something I would consider as chronic pain. Does that answer the question? Yeah.
Yeah. So my then the follow up is in terms of chronic pain, is that something that you can work towards fixing, or is it something that's obviously chronic, so it'll just persist?
So with chronic pain, and it depends. There are some certain people I've worked with that have had, chronic pain for months to years, and then I start working with them, and pain disappears, or severely decreases. Every person is just so different, and every case is just so different that um, there's no one size fits all. There's no such thing. I feel as everyone, like a person who has chronic pain, can never get out of chronic pain. It really just depends on the person themselves.
Right. So the issue
and
that
it also and it also does depend on the treatments. Sorry to cut you off. And it depends on
no,
the treatments that the therapist is giving. Um, sometimes there are people who go to PT and don't necessarily get a good PT, or they get a PT that is so focused in one train of thought that they're not necessarily taking a holistic approach that could have gotten this person out of pain quicker, um, than what they were necessarily going through. So, yeah, just to go back to what I was saying, everyone is so different.
mhm. Can you explain what you mean by the holistic approach? Because I think
Yeah,
the issue that I sometimes have with, not, and again, not all PTs, but some PTs that I've personally encountered
yeah, yeah,
are more focused on the what's causing the pain now and not necessarily investigating what's happening or what
yeah,
happened for it to be there. So can you just explain what you mean by the holistic approach and how do you apply it?
yeah. So when I'm thinking holistic, so when I was talking about holistic, I meant more from like a treatment style. So you know, and it also depends. And that's something you'll probably hear me a lot say throughout this
It's the
podcast.
same as me. It's the same as
Yeah,
me.
yeah, yeah. So it also depends. So me personally, depending on the person I'm seeing, I try to mix in, a bit of, or a lot of strength training throughout the session, but at times too, when indicated to as well, I use manual therapy techniques such as soft tissue mobilizations. I'm dry needling certified. I do cupping sometimes. So it really depends what the person is coming to me for, what their symptoms are, irritability, severity, and that kind of really is kind of what I'm basing my treatment approach in. Um, but to go back to what I was saying too, that's where that holistic component really comes in to really make sure that I'm hitting all cylinders um, of the treatment process to get that person out of pain as efficiently as possible. And then to kind of go back to the question that you're saying, a lot of PTs will just be, concerned about pain, but not necessarily, how they got to that pain. And yeah, that happens a lot, definitely. And that's where the history, taking a good history, really comes into, effect. That's where you find out, was it a fall, was it, has this person been running 10 miles every single day, and all of a sudden they have an overuse injury.
Yeah.
So yeah, that just really goes back to really taking a good history, really making sure you're asking the right questions, so you have kind of a map out to what could have possibly been causing the pain and how we got to where we are.
Yeah. So can you explain the process that you go through when someone walks in through the door? How do you assess them, and then how do you determine what kind of treatment plan they would need from then on?
Yeah. So, me personally, I definitely put a decent amount of weight in the subjective information I'm getting from the client or patient that I'm working with. At the end of the day, for instance, in school, we're taught a lot of special tests. But with that being said, special tests can be just what's the word I'm looking for? They could just be unspecific. For instance, let's say someone's a 9 out of 10 pin, and you try and do, some type of test on them, getting them in different positions and things like that. It's like if you're a 9 out of 10 pin, everything's gonna hurt. If I push on anything, and if everything hurts, what does that really tell me? So, and not to say that there isn't a time and place for certain tests, but at the end of the day, like I said, I put a lot of weight in what the patient is telling me, the subjective information, and then kind of going from there. And then, depending on some subjective points that they give me, that may kind of guide me to use a certain test possibly that I think is,
Mhm.
may possibly lead me down a certain path where I think my hypothesis is going. But one thing, as far as tests that I do use with a lot of clients that I work with, are manual muscle tests, but more of to kind of give me an idea of a certain muscle that may be irritated versus looking for a necessarily a quote unquote pathology that the person that I'm working with has.
Essentially, you're trying to fill out this puzzle in your head and what different contributing factors are causing this
Yeah,
pain. Is that correct assessment?
yeah, exactly, and that's I feel like that's where the assessment. Honestly, you're putting pieces of a puzzle together. You get a referral that says low back pain, and from there, you know that obviously that you're looking at the back, and and you're kind of piecing together what happens, what may be causing it, or you get a referral that says knee pain, and that doesn't necessarily even mean that it's because it's the knee just hurts. It could be coming from the back. So they're just so what you see on the that the doctor necessarily gives you. Because at the end of the day, too, the doctor, they're looking at someone for 5 minutes sometimes, and then they know that it's not something life threatening, so they refer them out to PT. And then that's where kind of I take over and kind of piece the puzzles together to get a more full picture of what's actually going on.
Yeah. So I'm always fascinated with this. And I've had Josh Chang on before, and he's exactly the same as you. But he's in a more private setting. But
Yeah, yeah.
he introduces these different types of strength elements and different what as strength coaches would normally use to coach an athlete or a client, but he
Yeah, yeah.
applies it to PT. Can you go through your methodology and using strength training and different elements of S&C and how you apply to your PT?
Yeah. So first of all, when it comes to working with patients and doing or applying the strengthening training to the from a therapy standpoint, it really starts back with severity and the irritability of the patient. So if somebody is, let's say they're coming in and they're in 8 out of 10 pain, 9 out of 10 pain constantly, I'm not going to necessarily just jump into, heavy squats or heavy deadlifts. We're going to more really take our
Yeah.
time and kind of easily kind of work our way up to that. At the end of the day, most of my patients, like, yeah, you're going to be squatting or deadlifting in some capacity at some point in our therapy journey. That's if you're more of a lower extremity injury, but sometimes even for shoulder injuries too. It really just depends. It really just depends. Um, but I'm really just piece by piece, um, just really building the patient up as time goes on. So it's not necessarily, we're not just jumping into it, but it's
Mhm.
kind of a slow, calculated process. But for some people too, let's say you're coming in and you have like 1 out of 10 pain, 2 out of 10 pain, 3 out of 10 pain, then we have a little bit more flexibility with what we can do, how hard I can challenge the patient. Because at the same time, while I want to challenge the patient, I don't want them to associate, coming to physical therapy with, oh, wow, this is going to hurt and this is going to be wildly uncomfortable the whole entire time. While I do think there is some pain that the patient may have to experience throughout the process, I don't want it to be that they're leaving me every single time in more pain than they came out of. Ideally,
Mhm.
I like them to try and leave me with hopefully less pain than they came out of. And with that being said, I feel like I'm talking a lot about pain right now, but something I try to do with a lot of clients that I work with is not to necessarily focus so much on pain versus focusing more on function.
Mhm.
A lot of times people, come to physical therapy, and I think it's also the way, students are taught. We think so much about pain. And, one of the first things that we're, taught in PT schools ask, like, you know, let's go 1 to 10, how much pain are you having? With that being said, there are patients that I work with who, maybe pain levels aren't decreasing dramatically throughout the time that we're working together, but function has improved a great amount as we've been working together. So, let's say they were in 9 out of 10 pain when we first started working together, and now they're in more of like 6 to 7 out of 10 pain, which, not a crazy difference, but okay, now you can put your shoes and socks on without,
Mhm.
getting insane amounts of pain down the leg while you're doing that. Now you can go to the gym regularly and you know what to do when that pain comes on, and it's not something that's necessarily going to freak you out and feel like you're doing damage and you need to go home and you can't do anything else. So really, PT physical therapy is so much more than just getting people out of pain versus also showing people how to live in unideal situations and know how to manage those symptoms too
Mhm.
as well.
So again, and I ask this all the time because I think it's a really important thing
Yeah, yeah.
to discuss is the psychology that goes behind coming back from any type of injury or pain. And you've just touched on it, and it's that making sure that people can feel comfortable knowing that they can do it again.
Oh yeah. Yeah. No, yeah, and so much of physical therapy, it's like I feel like it's almost like a disservice for PT to only be necessarily, especially in like the orthopedic setting, for us to only think of it as muscles and bones and whatnot. So much of this is, a mental, picture. There's so much that just ties together into this. Um, and that's really where, as I was saying earlier, you really do have to look at things from like a holistic standpoint to looking at people's moods when they're having pain, looking at how much, or thinking about, okay, are you sleeping enough, are you like, what does your diet look like? And again, at the end of the day, I'm a PT. There's scope that within the general healthcare system I am allowed to operate in, but pain is so much more than just, oh, sore muscles. Oh, I fell and hurt myself. I fell down and hurt myself. Sometimes I feel like there's a window that we're allowed to operate in. But with that being said, I feel that sometimes and trust me, there's a lot of stuff we learn in PT school already. But to be honest, sometimes I feel like there's so much more of a scope that we could operate in as physical therapists to really help our patients outside of just exercises.
Mhm.
Um, if you get what I'm saying.
No, I agree because it's always that fine line where when is my job over and when does someone else's take over.
Yeah, for
And I
sure.
think the PT and strength and conditioning coaches are a prime example, like in an athletic sense. So, say someone's came out and ruptured their ACL, cool. Surgery, they're in PT now. They can do their basic movements. They can take side steps. They can push off. Cool. That's what you did with the PT. But then when does that
Yeah,
role now become the strength coaches, and when is it, and when do we exchange that person from one to the other? It's a
yeah,
very
yeah, for sure.
murky line, but I think again we've discussed this in full length in this podcast, but it's all about communication.
Oh yeah, communication is key, and that's why I absolutely love working in a gym myself. At the end of the day, I truly do believe that personal trainers, strength coaches are on the front lines of preventative healthcare. PTs, at the end of the day, we get people when they're sick, when something's gone wrong, and that's kind of our scope, and that's kind of where we specialize. At the end of the day, in PT school, we're not really necessarily taught that much about strength and conditioning principles. A
Mhm,
lot of it is, more lower level type of ideas, and there is some strength and conditioning, but not necessarily not at all what I would say would suffice for the, even for the average like weekend warrior who is
mhm,
very, active. And then that's where I feel like a lot of PTs themselves have to kind of really take it upon themselves after school's over, after you've passed the board exam, to really understand those strength and conditioning principles so you can make a bigger effect and really challenge your patients and really make sure that, you're doing your patients the service that they deserve. So that's why, again, I feel like there should be 100% more collaboration between physical therapists, strength coaches, personal trainers, because I feel like we work with a lot of the same types of people. We just
Mhm.
get these people at different stages in the game.
No, 100%. And I like what you said there. It's that you need to challenge them to a certain degree of their comfortability, and it's like, again, going back to that example of PT and then strength coach, is that okay? I've challenged you as far as my role is concerned, but like, let's make
Yeah,
this transition a bit smoother and let's integrate a bit of strength training. And then when you get to your strength coach, he can do a little bit of PT side of things and then build up both elements.
yeah, yeah, yeah.
If you could break down your thoughts and feelings on fascia and how that relates to strength training and how you can help working through fascia and then adapt that into a person's rehabilitation or program.
Oh yeah, definitely. So I do definitely manual therapy on clients that I work with. I think that because one thing in the physical therapy space, there's definitely a. Sometimes I feel like manual therapy, working on fascia, is looked down upon. There's definitely, which I think is correct, more of a movement in PT of keeping our clients active, working them, strength training. Because at the end of the day, strength training does lead to longevity as we get older, gives us more freedom as we get older. So, which I completely agree with. But to that point, I do think that when, the right time and case is there, manual therapy, working on fascia is very important. I think that it helps with confidence as far as, if a client, feels that I have done something for them, I have loosened up tissue. They, someone that maybe have been previously injured or felt tense feels now that they have the ability to, run quicker, perform at a higher level. I also think from a just even scientific standpoint, as you're working on people's tissues, you're promoting vasodilation and increasing blood flow to an area and warming up the tissue and prepping them for those movements that they're going to be going towards. So, with that being said, you're increasing performance and helping this person with performance. Let's say it's an acute injury and this person can't really do anything at all. They can't really move whatsoever. And I do something like cupping or I do something like some type of soft tissue mobilization myself. Now they're able to bend their knee, 10 degrees more than they were able to. To me, that's a win. That means that we made some progress in that session. So with the right time and place, right client, I think that manual therapy, working on fascia, loosening up tissues, I think can be terrific, and there is a lot of use for that. But again, in the right time and place.
Yeah, and that goes back to what you're saying. It depends, and I think this is a
Yeah, it
really
depends.
important thing
Yeah,
because so much of our industry is let's see how this stimuli impacts the person, and
yeah, yeah, yeah.
it's constantly changing as well. Like what works for an athlete today may not work for him tomorrow, and it's having that adaptability to always go and assess different ways of moving or different performance elements that he needs or she needs
Yeah, yeah.
with someone that you've got coming in. Say we're talking about shoulder injuries or knee injuries, what are some of the processes that you go through to getting them back into a healthier level?
Yeah, so first off, it does, like I said earlier, it always does
Depends.
kind of start with that. It depends, but it also does start with the just the irritability and severity of the case. There are certain people where, first session we can start doing things like squatting. But then there are certain people that, we can just really just do lower level exercises just because they are just so inflamed, they are just so fear avoidant. Maybe they had a surgery that happened a week ago, and I have to follow a doctor's protocol to kind of, you know, get them back up to speed. So it really does depend on the case in point. But I guess to answer that question, I meet the client where they're at.
Mm,
So what I mean by that is, as far as what can you do and how can we push you enough where we're making gains and getting you each day better, improving each day. Um, so that's basically the best way I feel I can really answer that question.
yeah. In terms of pain and irritability, what are some management techniques that you go through with your clients?
So hand irritability. So let's say I'm working with somebody that is a avid gym goer, and a lot of times they go see their PCP, and the classic line is rest, don't do anything for a month, and pain will just disappear. But obviously, we both know that rarely that ever happens. With a lot of patients that I do work with, I'm more of telling them, okay, what can you do that isn't going to set you off? How can we keep you active where you're still doing things that are meaningful to you without, you leaving the activity and feeling like, you know, it wasn't worth it because now you're in 10 out of 10 pain. So, I try my best to, you know, still keep my clients that I'm working with moving, but with that being said, not flaring them up. For instance, there's a guy, he avid cycler that I was working with. He said that, after cycling for, I think he would cycle for like 40, 45 minutes at a time, he would start to get really bad back pain, and he was telling me just getting so bad that like I'm just going to just stop cycling altogether. And told him, I was like, well, have you thought about maybe cycling for 15 minutes, seeing how that goes?
Mm.
Have you thought about cycling for 20 minutes and seeing how that goes? And he told me no, I hadn't at all actually. And I told him to go home, see how that feels. And this guy was able to cycle for 25 minutes without pain coming, and it really told us something that unfortunately at the time he couldn't be cycling for those 45 minutes because the pain was so bad. But that doesn't mean that you can't do any exercise whatsoever. And I think it really goes back to this, idea that so many people have this all or nothing idea when it comes to health and fitness. When it's just like, no, it does not every, not every exercise has to be, absolute beast mode. We're squatting 500 pounds, PRing every single day.
Rah rah
No,
the
it
whole
doesn't have.
time.
Yeah, no, exactly. And trust me, I love that. I love, and I'm guilty of overdoing it myself. But at the end of the day, yeah, it doesn't have to be like that. At the end of the day, as long as you're consistently showing up as much as you can, and what works for your time schedule, or what your life kind of has you in, it doesn't. You don't have to. You don't have to kill yourself every day, and just because you're having pain as well doesn't mean that you can't still do the things that you like in some capacity. It may look a little different than what you're used to. You could still get after it though, regardless.
Do you try and work a lot on pain tolerance and how to build up that tolerance over time?
I would say a lot of patients I work with honestly just get better as the time goes
Mm,
on. So pain tolerance isn't necessarily something that we're really focused on. I feel like we're not necessarily thinking about pain tolerance versus knowing how to modify things when the pain
mhm,
comes on, or knowing, is the pain too, can I handle this pain? But I think a lot of it is just, working with, modifying pain, or sorry, modifying exercises so that they can still exercise um, while having,
mhm.
whatever setback they're having, but being able to still live an active life.
So that's exactly what I was wanting to figure out is it's like so I always have this thing where there's no injury prevention, there's injury medication. So you can't prevent an injury, but you can mitigate the effects of the injury occurring. And
Yeah, yeah,
then tolerance that is useful in some cases, but you're more wanting to adapt a certain type of movement to it still have the same movement as you're wanting. So say you want them to squat and it's a back squat. If they have pain during that back squat, all right, let's maybe switch it up and do a goblet squat, less intense, but they're still getting that squat movement, squat pattern
Yep,
happening. Is that
yep.
sort of the processes that you're going through with your clients?
Yeah, and honestly, there was someone that I was working with. Literally, it was actually the reverse of what you said. They were actually doing a lot of front squats themselves, and I told them, "Well, have you ever, thought about doing back squats instead?" Because they're going to the gym every single day and do, or not every single day, but every leg day they were doing front squats, and they had a lot of knee pain, which I honestly thought that made sense. Doing front squats only. They've been doing front squats only for a year. Not to say that that's not to say that front squats are bad or not. Everyone that only does front squats has pain, but he was having like searing pain every single time he was doing front squats. So I told him try back squats, see how that works, see if that causes the pain, and magically he just was not having any pain whatsoever. Just literally just switching up the stimulus that he was
Mm,
getting. So that's where, like you were just saying, making those appropriate modifications. Doing things like decreasing the range of motion. There was a woman at the gym that I was working with who she was having a lot of pain while she was deadlifting, and I told her, "Well, have you thought about modifying the range of motion?" She had not thought about that. She felt as if she was cheating and not
mm,
doing the full exercise if she modified the range of motion. And I told her, like, listen, like, as much as we're in the gym to challenge ourselves and feel like we got a good workout in, working out is supposed to be fun and make you feel good. You shouldn't be leaving the gym every time feeling like you're in worse pain than you came in. Some soreness is okay. There's going to be some soreness, but at the same time, you shouldn't feel like you're doing more harm to yourself than good.
100%. That's actually one of the lifts that I nowadays have more issues with than not. So I
Yeah,
used to be like a deadlift meathead. Like everything was
yeah,
about deadlift. You need to
yeah,
build that
yeah,
deadlift
yeah,
up.
yeah, for
Deficit,
sure.
trap bar was cheating.
Yep.
All I went through all of those phases. But
Yeah,
nowadays, if someone really wants to do a like a straight bar deadlift, I'm like, cool. But let's consider your leg length as well. So
yeah,
for people who have longer legs,
yeah,
let's put some plates underneath that. Let's even out the distance that you're actually having to travel, so that you're traveling the same as me. I've got, funnily enough, my legs and torso are very evenly matched. So deadlifting, straight bar, amazing. I can do it perfectly and I'm good with it.
yeah,
But for people with longer legs, they need that play underneath to sort of even that length out. And it's that little change that people are like, oh, but I'm cheating. I was like, no, you're deadlifting for your body.
I think that's an awesome point that you brought up. And I do feel like sometimes I think that there's been more of a shift in the health and wellness space of taboo things like using a trap bar
Hmm.
or, not going as hard as, you could every single day. I think that the shift, honestly, is happening almost more to like a mental health thing versus just looking good, which I think is awesome. And not to say that there, aren't certain people that, still do kind of have this toxic view of like health and fitness and things like that. There are always going to be people out there like that, like any industry. But I do feel like people are making that shift, and I think it just makes it more accessible to people, working out more accessible to people, staying healthy more accessible to people. I think it makes you feel more comfortable coming into gyms.
No, 100%. And it's again, it's so I've been having this debate quite frequently now, and it's
Yeah,
I'm looking at exercising as movements that are required for your day to day lives. And this is why
yep,
I really love speaking to PTs and people who are more in that. Let's just get people moving first.
yep,
Let's,
yep, yep.
and I've always said, you can only move your muscles certain types of ways. It doesn't
Yeah,
matter
yeah,
if it's with a kettlebell, a dumbbell, a special bar, a barbell, cables.
yeah,
Every other
yeah,
type of stimulus is cool for variations, for adaptations, for different just to make a workout fun too. The bottom line is you can only move in certain ways. So let's make that those as efficient as possible, no matter
Yeah.
what kind of equipment you have.
No, yeah, I completely get that. While some people, I feel like people call it like working out, and then some people call it training. Idea of training versus working out. I mean, I feel like working out sometimes is associated with, okay, I need to go to the gym so I can break a sweat so I can like look good, or say I burn this many calories. Versus like training, it's like, I'm training so I can have a healthy and long life with you know as little set health setbacks as possible. I'm training so I can, pick things off of the ground easily. I'm training so I can, for some people, pick up my kids, play with my kids easily. And I think that is a great shift that is happening. And with that too, it's like you see people working out in different ways these days.
Mm,
People aren't necessarily just going to the gym, and not that there's anything wrong with it, but people aren't necessarily just going to the gym right now anymore and like just trying to chest press as much as they can, or try to shoulder press as much as they can. I feel like you're seeing people more of care about working out, training with mobility in that
mm,
in the equation too as well. While they're in the gym, you see people working more on things like balance and coordination while they're in the gym. So these are all just really important things. Where you're working on these things, and you're not necessarily, it's not going to get you necessarily ripped and look like amazing, but that's where you're
mm,
taking into account that longevity
mhm.
standpoint,
It
and
provides some
making those.
functionality as well.
No, definitely, definitely, man. Providing your body with those adaptations, and especially as you get older, because these are things that, unfortunately, as we know, so it's just like it's awesome to see more and more people caring about those things, and those things becoming more at the forefront of the
Mm.
gym and health and wellness, space.
Exactly how that movement helps with sort of getting that stability back into shoulders and press ups and all that stuff.
Yeah, so it's kind of like, for instance, I am doing regular dumbbell press. Um, with a dumbbell press, albeit, not to say it's an easy movement at all. There are plenty of people that have pain with even just normal dumbbell presses, but the weight distribution of the actual dumbbell itself is even. So moving it through motion is not nearly as challenging as, you pushing up a weight that is oscillating at the same time as you're pushing it up, really causing those stabilizers in the shoulder to engage so that you can stabilize the humerus during that overhead motion. And with that being said, you're really activating those shoulder stabilizers, um, because you're working in an unstable situation. That's what helps with strengthening of the rotator cuff, and helps translate over to your everyday activities as well.
I've been using that exercise quite a lot for my shoulder stability, and it's that and
Yeah.
kettlebells up. Now, that kettlebells up movement makes it so much harder because like it's obviously pulling you down with the gravity element, but you're also having to fight to sort of keep it in in the same place. Is that something that you
Yeah.
use a lot of to again build up that resilience in that sort of shoulder griddle and rotator cuff movements?
Oh yeah, 100%. And in general, I use, for shoulder stability, exercises. I use a lot of kettlebells.
Mm,
That's honestly my kind of primary tool I use for a lot of stability exercises, because a 10-pound kettlebell is a heck of a lot different than a 10-pound dumbbell. And that really just goes back to the shape distribution of the kettlebell versus the dumbbell, and how it travels through gravity, how you have to balance it while you're moving that weight, versus a dumbbell. And again, not to say that dumbbells by any means are bad tools, they're great tools. But I use kettlebells a lot for a lot of shoulder stability exercises, a lot of balance and coordination exercises. For me personally, I use a lot of
Mhm.
kettlebells for a lot of rehab work myself.
So that's something that I also do a lot of, and it's for the exact same reason.
Yeah,
The weight distribution is so different, and you can sort of alterate how hard a lift is by simply switching it from like a normal like holding position. Again, it's back to that movement ranges and difficulties that we can achieve through
yeah.
different equipment. We'll say.
No, yeah, definitely. And I mean, at the end of the day, it's like in the rehab space, and I'm sure same thing in the strength and conditioning space. Anything that we have at our disposal in the gym and the clinic, like these are all tools to make our the people that we work with faster, stronger, more resilient. So I feel that the more of an understanding that we have of any of the things that we have in the gym, the better results we get, the quicker we can get people better, the quicker we can get people moving faster and more refined. So I really think, me personally, as a physical therapist, I have to take it upon myself to learn how to use these tools so I can help my clients out as efficiently as possible.
100%. I was just speaking at a conference in Italy this past week, and a couple of coaches asked me like, how do you go into like any type of gym and just make do with what you've got and not have like all the equipment that you want? I was like, well, the thing to think about is you're only as limited as your imagination.
Oh yeah,
Say, like I've once made a sled out of a step up. I put some heavy kettlebells, tied a battle rope onto it, and I just started dragging it. Like that was a decent pull exercise that I did just by combining three pieces of equipment. And it's that you're not always going to get the fanciest gadgets all the time into your facility. So let's make do with what we've got. Let's not think about, "Oh, damn it, I could have done this, but I don't have that equipment." How can you adapt the situation that you're in and make it so you're doing the exact stimulus that you want to achieve with your athletes or
yeah, yeah,
clients?
yeah. And I feel like that's part of the job description at the end of the day. Not everything's going to be always under ideal conditions. And that's where you use that knowledge that you got from school or whatever certification that you got in order to think outside of the box. I mean, that's why you're the professional. At the end of the day, like we study for these exams and that tell us, spit this back to me. But at the end of the day, the real world's nothing like the, you know, 5 to 6 hour exam that we sit staring at a computer screen, um, regurgitating information. Um, I could be as
100%.
crazy as I could be as crazy as say it's actually the exact opposite of that. Because there's a certain standard that you have to be up to, so they know that you're not hurting people or know that you're not, putting people at risk, which is great, fine and dandy. Completely get that. But at the end of the day, too, you would hope that anyone that is able to pass those exams has the, I guess, reasoning skills and capabilities to think on their feet, make their own programs, rehab, strength programs for you, to a way that really caters to the person standing in front of them. At the end of the day, if you can't do that, it's like that exam you passed doesn't really mean much,
Mhm.
in my opinion. But yeah,
100%. I constantly go through that where I see people like finishing their degrees and accreditations, and then that's where their learning stops. And I'm just like, that's where it should fucking begin. That is where it
no,
should begin.
definitely, definitely. For sure, man. For sure. I mean, that's why I'm not sure if I said this to you, but I'm currently in the process, little by little,
Yes,
studying
yes,
for
yes.
my strength and conditioning certification. At the end of the day, I love, being a physical therapist, but I am equally, if not maybe even more passionate about just strength training. I love trying to push myself in the gym. I love trying to get as strong as possible. Because even day with strength, it's like you just can't go wrong with being as strong as possible. That is what that's your armor at the end of the day. That is what is going to give you longevity at the end of the day. That's what's going to keep you, even if you're strength training isn't your primary hobby, that's what's going to keep you playing recreational basketball, recreational tennis, doing the marathons that you do. Yeah, that it just makes the aging process a lot more smooth. That's
100%.
why, as I've graduated from physical therapy school, it's really that the next chapter is really, you know, making myself a student of the strength and conditioning realm, because I do think that there's a lot of awesome work that you guys do, and I think at the same time too, there's a lot of work that I could do that'll further help me along with getting the results that I need out of my clients and patients. Because as I said in PT school, we're taught about these principles, but nowhere in the realm that I feel that, um, you know, what we call ourselves, a doctor of physical therapy, should be, in my opinion. And that's why, I think that every physical therapist should be taking upon themselves to understand, um, yeah, those those conditions.
Yeah, the basic principles, and then I think it's the same for sort of me. Is like I love speaking to PTs because you just have a different perspective on how to develop an athlete or develop a client
Yeah.
from an injury standpoint. And I love having these conversations because I learn these processes as well. I I've I'll put this out there. I'm not going to go through PT school. I don't think
Yeah.
I could. That I love my sanity too much to go through another 3 4 years of a different
Yeah. I mean,
element of what I
I
did.
would I wouldn't recommend, bro. I wouldn't recommend. It's a grind, my guy. It's a grind.
I will say though, I completely 100% agree with you. It's just a piece of paper, and the practical element of what you do is the most important one. I am
Yeah.
chasing it. I am chasing that simply because I want to keep doing the research that I started in my bachelor's. That is the sole reason of me attempting it, because for me, practical experience is fundamental to grow in this industry, and you cannot become great at it without having that practical element of it. That's
Oh
just a
yeah,
fact.
definitely, definitely. And I feel like too, it's like we're talking so much about, knowing about, all this information, but it's also at the same time like you gotta know how to connect with people too as well. You gotta get to,
And
and
that
it kind of goes
buy-in.
back to what yeah, oh my God, buy-in is, it can really, tell you, really point the treatments that you're working with
Mhm.
somebody in one direction or the other if there isn't any buy-in, to be completely honest. Um, so yeah, just go back to what I said. Like it just what we do, like you're really getting to know somebody. You're really it as much as you're doing strength and conditioning. I'm doing physical therapy. We're also sometimes we end up becoming friends with these people. Sometimes we end up just things go down paths that you're not necessarily going to necessarily think it's going to go through, and that's why I feel like it's just so important to be able to
Mhm.
know how to talk to people and how to connect to people. Um, like 2 weekends ago, I was helping someone I work with move a couch at their family friend's place. Beautiful house, by the way. But like, had you told me that I'd be, we were hanging out there. Had you told me, you know, a month or two ago when I started working with this guy that like I'd be at his, place helping a family friend or his family friend's place, helping them move a couch together, having a laugh together, joking at the end of it, I would have said absolutely no way. But again, that really goes back to just being able to make connections with people, being able to talk to people. Because yeah, like as much as we're there to do a job, to get somebody better, get someone moving better, get someone to perform at the top of their game, I do think we also are there to get to know the person, get an understanding of who the person is, what their fears are, what their expectations are. So it, it it goes so much more, I feel, than just also just the X's and O's of the
Mhm.
situation.
100%. Like this example has constantly been mentioned on this podcast is you can make and program the best program in the world. It could be as fundamentally solid as possible. But if
Mhm.
that person doesn't like you, they're not
Oh
they're
yeah,
not going to give a fuck. They don't care about the program. They
yeah.
won't do it.
No, no,
So
absolutely.
if you're not matching sort of their likes and knowing what their dislikes are and catering that program to them, it's done. You're done.
No, yeah, yeah. And that's again where that really we comes back to that. You know, like I said, connecting with somebody, seeing them where they're at, um, not just looking at the X's and O's of the situation. So it's there's so many parts of the job that a lot of people don't necessarily think is going to be part of the job when you start out. But you know, at the end of the day, it's like if you want to be truly elite and good at what you're doing, you kind of have to really take those parts of the job into consideration. You know,
100%. What is your PR song? I love getting this from different
my
people.
PR song. So I don't know. I mean, honestly, when I'm like vibing in the gym, I don't know if you know of Rufus the Soul at all.
No, I do not.
Yeah,
This is why I love
they're
this
kind of like
question.
yeah, they're kind of like I think they're actually I think they're based out of the I want to say they're based out of the UK somewhere maybe, or maybe it's I don't know. It's like there's somewhere not in America I think, or maybe I'm wrong. But I if I'm like in a rut at the gym with music, I usually go back to them and kind of vibe out. Yeah, yeah, that's
Okay, I will
so
put this on the playlist to check out.
yeah,
So I
it's
love this
definitely
question because it
yeah.
gives me the different perspectives of what people listen to in the gym and how that impacts their like top level performance.
Oh yeah. I'm bumping some Rufus when the time comes. If I'm really looking for like ultimate vibes and you know really trying to push away. It's kind of crazy. Music, I do think sometimes really does take you to that next level when the time is needed.
So
It changes the vibe of the things.
100%. So I've read studies that it can be up to 12% performance increase by listening to
What?
music.
I believe it. I
It's
mean, as
unreal.
someone that, yeah, as someone that strength trains, I mean, even like when I'm on a run, like the last like mile of it, I'm like, okay, I'm bumping this to get me through, and then like I'll look at my time, and it'll be like, even though it's the end of my run, it's like this was the fastest segment of the run, and I remember, oh wow, I was listening to such and such during this time, so I believe it, man. It's crazy,
100%.
bro.
Again, I've
Yeah,
mentioned this on this podcast, but I have to mention it again. So, and again, I don't like him. I just like his music because he's undeniable. But Chris Brown gets me through cardio.
I knew you were gonna say Chris Dodd. I knew you were gonna say that. As soon as you said I don't like him, but I like his music, story of anybody and him. I literally knew you were gonna say that. But yeah, I get it, man. I get it. I get it. I get it, bro.
It's like
But no,
I don't know what it is, but like he just gets me. Like if I've got like a grueling session on a rower, I'll bump
yeah.
on his albums and I'll just be vibing to that.
I mean, hey, I mean, I think that most people say that. Yeah, he makes some very catchy tunes. He does make some catchy tunes, but so I get it. I get it.
Yeah. Oh,
Yeah.
recently I've been bumping "Not Like Us" by Kendrick, and I'm just like,
Oh,
oh,
oh yeah, Kendrick. He makes some bangers himself as well. Cannot disagree with that whatsoever.
like I'm loving the beef that's going on right now. I fucking love
Oh
it.
yeah, oh yeah. It's kind of crazy. It's kind of crazy that these things are being put out on the air like this.
Perfect. Thank you so much for coming on, Obo. Was a pleasure having
Yo,
you.
thank you,
Talk.
Maddie. Appreciate you, brother. It's been a great conversation. That went by really quick, but you know, time flies when you're having fun.
Exactly. No, it's like I said to you, it's like I love having these conversations because you learn so much. Like you're obviously an expert at what you do, and I'll honestly say, and I've said it before, this podcast is very selfishly for me. Like I love
Yeah,
learning from different professionals and how they view the industry and their different
yeah,
processes. So I love speaking to anyone.
yeah, for sure. And hey, man, I've looked through some of your content, and yeah, yeah, you've had some. good conversations on here. You're definitely doing something right, man. You definitely are.
Appreciate you. That is
Yeah, for
literally,
sure.
I love that. Thank you so much.
Of course,
Because
man.
again, it's just conversations. I love having a conversation with coaches.
No, for sure. And I think more of these, like, it goes back to what I said, like very, very early on in the conversation. More of these conversations need to happen between, strength coaches, PTs, personal trainers, whatever you want to call it. More of these conversations have to come because I think we're a lot more alike than people understand and realize. Um, Even myself, like, you know, working at a gym, doing treating out of a gym, working with all these clients. Um, there's so many things that I'm learning, from strength coaches, people that work here, and also seeing so many similarities too as well.
So that's actually a really good point that you bring up, and it's something that I talk a lot about. Is like this industry shouldn't be viewed as PTs, physiologists, biomechanics, sports psychologists. They are actually all together, and we need to sort of
Yeah,
learn from each other and speak with each other about how we can all implement the same sort of structure to better that person. Because it's not about us as much as we like to think we are the ones making a difference. It's about them and
yeah.
we can help them with.
No, for sure. And I do think there's a lot of egos at play when it comes to this stuff, which is I feel like what kind of stops progress that could be made. At the end of the day, like I get it, like everyone has their specialties, nobody knows everything. At the end of the day, like we are literally taught different things, hence why we have different names, and we have different certifications and whatnot. Um, so why wouldn't you want to lean on each other so you can make yourself, better, and more holistic in your approach? So I just don't really, like I said, I think it's a profession. Some of our professions are very driven by ego. A lot of macho men and women who I guess think that they know everything,
Mm-hmm.
but it doesn't have to be that way. And I wish that more conversations like this did happen.
100%. I always feel like the more I push through this industry, the less I actually know.
Oh, I mean, hey, man, yeah. But I mean, at the end of the day, that's a good thing because it just means that every time you're learning something, then so it may seem like I guess you don't know a lot, but you're actually learning a lot, though. So yeah.
100%. No, thank you so much for coming on. If you want to shout out your Instagram or where people can connect with you.
Oh, for sure. Obo.physio. That is right here. So give me a follow. Appreciate you, Manny.
No, it's all good. And do follow him. He's got some very good movement based work on his page. And that's, again, the way that I like to view PT is all through movement and how do we better movement through time.
For sure, man.
That's it.
Completely agreed.
Perfect. No, thank you so much. And I'll catch you at some point. Peace.